So, hi everyone, welcome to Farre Series, lecture number 6. In this session, we are going to discuss some important prof questions as from your toxicology. Hi, hello everyone, welcome to Farre Series. We are going to discuss some important questions as from your toxicology, that is forensic toxicology. Yes, Ashok Kumar, am I audible? Am I audible? Audio video, is it clear? Shall I start? Yes, Ashok Kumar. See, toxicology covers around 25% of your total mark in prof exam. So, out of 100 mark paper, around 25 marks do come from forensic toxicology. Yes, Dheeraj Chaurashia. Fine. Okay. So, let's start with the one very important topic, that is animal organic irritants. So, one very commonly asked question in your prof exam is about animal organic irritants, that is basically snakes. So, the question very frequently asked, name big four snakes in India. What are big four snakes in India? Explain signs and symptoms and also about the management of snake bite. So, this is asked as a 10 marks question. 10 mark question. So, what are big four snakes? What are signs and symptoms? Management, treatment, what are the investigation and medico-legal importance? You need to write in the exam. Yes, Pratik and Dheeraj. Pratik and Dheeraj. Okay, let's start. Let's start with the big four snakes. Then what is the fatal dosage and what is the fatal period? Then what are the signs and symptoms of snake bite, especially neurotoxicity and hemotoxicity? Then what are the investigation done in case of snake bite? And lastly, the management and also a few points about medico-legal importance. Very frequently asked. Okay, Namaskar, Dheeraj, Pratik, Ashok, everybody. Okay, let's start with the topic number 1, big four snakes in India. Yes, can anyone name big four snakes in India? Big four snakes means common snakes in India. What are they? Anybody? Can anyone mention what are big four snakes in India or common snakes? Let's see who is going to answer. Okay, common cobra. Very good, Sumana De. Common cobra, common crate, star-scaled viper, Russell's viper. Excellent answer, Sumana De. She answered, sir, common cobra, that is Naza. Common crate, that is Bungarus ceruleus. Russell's viper, that is Dubai Russelli. And the one more is star-scaled viper, that is Achis carinatus. So remember, there are big four snakes: common cobra, common crate, Russell's viper and the saw-scaled viper. Big four snakes are common snakes in India. The polyvalent antivenom that is going to protect these four snakes. Okay, yes, very good. So Kalim, beta, very good. Now we are starting with the first image based question. Look at this snake and try to identify. This snake has a hood. You can see the hood here. Okay, hood, and also you can see the spectacle mark. So anybody, what is this? So when you see hood and a spectacle mark, round pupil, so what is the answer? Anybody can identify this? Can identify? This is very good, Rutik Singh. This is a common cobra. Very good. Common cobra. Very good. So what are the features of common cobra? So one, there is a hood that is present. Hood is present. Spectacle mark. Spectacle mark. Round pupil. Round pupil. Any other point other than this hood and spectacle mark? Any other point go in favor of common cobra? So remember, third supralabial. So the one very commonly asked, third supralabial. Third supralabial that touches both eye and nostril. So that touches eye and nostril. That is the feature of common cobra. This can be asked as a MCQ in your exam. So in a snake examination, the snake has a third supralabial which touches both eye and nostril. What is the most common snake implicated? Your answer should be common cobra. Okay. Yes. Now here remember, the fatal dosage of dried venom is 15 milligram. 15 milligram. The 15 milligram can lead to death of the human, and the fatal period is 30 minutes to 6 hours. So most of the signs and symptoms, they starts in 30 minutes. They are going to complete by 2 hours. The fatal period is 30 minutes to 6 hours. And king cobra, when the question asked, remember king cobra larger in size. The scientific name is Ophiophagus hanna. The fatal dosage is 12 milligram. So this is one big four snake. Big four snake. The next, can identify this snake? Anybody? The second big four snake common in India, which has a triangular head. So you can see the triangular head, constricted neck, broad body or belly, pointed tail, and brown spots are there. You can see the brown spots. Can anyone identify this snake? Yes, very good. This is your Russell's viper. Very good. Very good. Who answered? Sumana they answered, and also Kalim answered. It is actually Russell's viper. Russell's viper. So what is the scientific name? Dubai russelli. Dubai russelli. What is the fatal dosage? 40 milligram. What is the fatal period? 1 to 2 days. 1 to 2 days. Okay, Russell viper. The vipers are hemotoxic. They cause hemotoxicity, hematuria, and other signs and symptoms and death within 1 to 2 days. So vipers are hemotoxic. Alapidae, they are neurotoxic. Try to memorize this. So this is the second, that is snake, big four snake. And the third one, anybody can identify this third one? The third snake which is visible on the image, which is showing white wavy line. White wavy line, which has also has some bird foot mark. Bird foot mark over the head, diamond shaped area. So what is this? Anybody? So this is saw-scaled viper. Very good. This is saw-scaled viper. So what is this? Saw-scaled viper. Saw-scaled viper. So what is the fatal dosage? The fatal dosage is 8 milligram. The fatal period is 1 to 2 days. 1 to 2 days. So in exam the question can be asked, name big four snakes. You need to mention like this: common cobra, Russell's viper, saw-scaled viper. One more is there. What is that one more? Look at this snake. So this snake is nothing but your common crate. Common crate. So common crate which has a white transverse line. White transverse line. Common crate has white transverse line. You can see steel black in color, no triangular head. So it is probably common crate. The scientific name is Bungarus ceruleus. The fatal dosage is 3 to 6 milligram. The fatal period is 18 hours. In fact, it is the most common snake in India. Yes, common crate. So let me write here, common crate has white transverse line, white transverse line and steel black in color. Steel black in color. The fatal dosage is 3 to 6 milligram. The fatal period is 18 hours. 18 hours. So dear students, when question asked in your exam, big four snakes, there are four. Common cobra, common crate, Russell's viper, saw-scaled viper. Scientific name, naza, Achis carinatus, Dubai russelli and Bungarus ceruleus. The most toxic, the most fatal snake is your common crate because the fatal dosage is 3 to 6 milligram. Okay. Now one more point here. Common cobra and common crate, they are neurotoxic. They comes under Elapidae. Vipers are basically hemotoxic. They cause hemotoxicity. They cause hypofibrinogenemia. It causes DIC and death. So vipers are hemotoxic. Elapidae are neurotoxic. So there are some other snake known as sea snake. They are basically myotoxic. So it is also can be asked in your exam. So Elapidae, Viperidae, and one more is Myopidae. Myopidae, they are basically myotoxic. Myotoxic. Yes, Anchan Khan, good evening. Fine. Now all of you go through this image and the video, identify what is the probable snake bite here and what is the probable lethal dosage. Look at this video there. So video that is showing a case of snake bite. The patient is having ptosis. Patient is also having difficulty in breathing, and also you can see clearly visible bite mark there. He was treated with polyvalent antivenom. What would be the best answer for this question, guys? Come on guys, come on. So look at this image. Yes, what is the answer, guys? So what is the answer for this question? Anchan Khan and others. So this is common cobra bite. Common cobra bite. The fatal dosage we discussed 15 milligram, and it is neurotoxic. And it is neurotoxic. So this is the answer I wanted. Very good. Mehdi Hussain Sheikh 15 milligram. Kishore, very good. Sumanade, very good answer. One more, look at this snake and identify what type of snake is this and whether it is myotoxic, neurotoxic, cardiotoxic or hemotoxic. So look at this. Triangular head is there, constricted neck is there. So triangular head, constricted neck, broad body, brown color spots, looks like your viper. It is hemotoxic. Very good. So this looks like viper, and this is probably sand viper, and it is hemotoxic. Hemotoxic. So okay. So all of you guys, is it clear? Is this clear, guys? Big four snakes in India. Any doubt in this? Hemotoxic. Very good. Mehdi, Aditya Singh, Sumana De, Kishore. Excellent answer. Come on. Say yes or no. Is it clear, guys? Shall we go? Yes, fine. So next is the signs and symptoms. Before that, look at one more image here. One more image, very nice image, that is showing third supralabial. Third supralabial that touches the eye and nostril. That touches the eye and nostril. What is the probable snake given here? So what is this snake? So third supralabial touches eye and nostril. So what is the answer for this? Anybody? Anybody can answer this? Yes, very good. This is your common cobra. Common cobra. And this is the fourth infralabial, which is largest. So this is common krait. Common krait. So try to memorize. In common krait, fourth infralabial, which is largest. Largest. This can be MCQ in your prof exam, can be Viva question. Viva question. Okay. Yes. Next is the signs and symptoms. Common cobra bite. So what are the signs and symptoms of common cobra bite? So can you answer, guys? What are the signs and symptoms of common cobra bite? Yes, anyone? What is the earliest symptom? What is the earliest systemic symptom? Earliest. So local symptom, the pain, pain at the site, swelling and all, start that within the 30 minutes. My question is earliest systemic sign. Your answer should be ptosis. So ptosis can be a feature. Yes, ptosis. Then can be dysphagia, difficulty in eating, difficulty in drinking, dysphagia, difficulty in talking, dysarthria, difficulty in talking, dysarthria, abnormally sleepy, sleepy, drowsiness, convulsions, neurotoxicity. Okay, neurotoxicity, that is very common in case of common cobra bite. Common cobra bite. Okay, fine. 5Ds. Okay, 5Ds and 2Ps. Fine. So ptosis, dysphagia, dysarthria, abnormally sleepy, drowsiness, convulsion, neurotoxicity, local signs. All these are common in case of common cobra bite. So basically, it acts on postsynaptic region. Okay, postsynaptic region. It produces alpha bungarotoxin. Alpha bungarotoxin. So alpha bungarotoxin, which causes decreased levels of acetylcholine. Decreased levels of acetylcholine. Finally, respiratory paralysis. Respiratory paralysis. Okay, respiratory paralysis. Remember, common cobra venom is postsynaptic. Common krait venom is presynaptic. So this is also asked in your exam. Common krait venom is there now, that is presynaptic. Common cobra venom, that is your postsynaptic. So both are very commonly asked in your exam. So what is the cause of death? Respiratory paralysis. Respiratory paralysis. Okay, 5Ds and 2Ps we discussed in our classes, fine. So also you can remember that. So there is one more sign known as broken neck sign and all, that also you can write in your exam. Anybody, what are the features of common krait bite? Anybody, anyone in the class, can you tell me what are the features of common krait bite other than these signs? Any other point? Common krait bite. Common krait. Bungarocereus. The fatal dosage is 3 to 6 milligram. It produces beta bungarotoxin. It acts on presynaptic region. It causes respiratory failure and death. Anybody, what are the features of common crate and how to differentiate from common cobra bite? Yes, paralysis fine. Paralysis is there, very good. So remember, there is a paralysis but no convulsion. So there is a paralysis but no convulsions. So convulsions are very minimal. So convulsions are very minimal in common crate bite, and most of the time common crate bite is there, no, that is painless. Local symptoms are very minimal and sometimes they are invisible. That's why it is confused with stroke. So signs and symptom confused with stroke. So patient may present with nausea, vomiting, patient may present with abdominal pain and all, and local symptoms are very minimal. So sometime it can be confused with stroke in elderly person probably. So this is also asked in your exam. The snake bite which resemble like stroke, your answer should be common crate. Okay, yes, Rutik Singha, very good, yes, fine. Okay, now what are the features of viper bite? What are the features of viper bite, guys? Viper bite. Anybody? Viper bite. Let's discuss about the viper bite. I said it is hemotoxic. Can anyone answer what are the features of viper bite? Yes, local symptoms are common. Okay, local symptoms. So what are local symptoms? Local symptoms like hemorrhage, bleeding, swelling, pain at the site, edema, all these are common in case of viper bite because they are hemotoxic. And one more thing, spontaneous bleeding is very common in case of viper bite. So there can be bleeding into peritoneum, so bleeding in the vital organs, there can be hematuria, there can be oliguria, so other features also present. So all these are features of hemotoxicity. So vipers, local symptoms are maximum, and also there are features of DIC as well. Okay, DIC, hemorrhage, blisters, very good. Rutik Singha answered, sir, blisters are very common, excellent. So blisters are very common in case of viper bite. So this is about the common cobra bite signs and symptom, common crate bite signs and symptom, and also viper, so signs and symptom. Cause of death in case of viper bite is hemotoxicity, that is probably DIC, disseminated intravascular coagulation. Cause of death in case of common cobra bite is respiratory paralysis. So this is how you should answer in your exam. Okay, yes. Now identify this clinical finding. So what is this? There is a history of snake bite, there is a history of ptosis, the patient is also abnormally sleepy, patient is having dysarthria, difficulty in breathing, abnormally sleepy. Probably what is the snake bite? Is it viper or it is LAPD? Come on guys, come on, try to answer this. Sumana De, Rutik, Akash, Bathi, what would be the best answer for this? Okay, bro, it is okay. So this is your common cobra or common crate. So this can be common crate or this can be common cobra. So this is basically LAPD bite. LAPD. Good, very good, LAPD. The finding is ptosis. So I said earliest finding is ptosis. Okay. Okay. Now look at this picture. Try to answer. What would be the probable snake bite? So there is a hematuria. Parotid enlargement. You can see the parotid enlargement here. You can see the blisters You can also see kidney failure here. Kidney failure, acute kidney failure. So what is the best answer? So this is your viper bite. Viper bite. Viper bite. Okay, good. So this is your viper bite. So next is the investigation. So what investigations we are going to do in case of snake bite? So very simple it is. In case of Elapidae, we are going to measure the levels of enzymes, that is acetylcholine esterase enzyme, by doing enzyme immunoassay or radioimmunoassay. In case of hemotoxic snake bite, we are going to measure the levels of fibrinogen by doing some simple test, that is 20 minutes whole blood clotting test. So investigations, so enzyme immunoassay, enzyme levels, that is the most common investigation, or radioimmunoassay, that is the most sensitive investigation, or else one common investigation, bedside investigation, that is 20 minutes whole blood clotting test, 20 WCT. Okay. So this shows the levels of fibrinogen. So what it shows? Levels of fibrinogen. You know what happens in hemotoxicity or in viper bite? There is a decreased levels of fibrinogen. Because of that, there is a high tendency of bleeding. We call it as spontaneous systemic bleeding. Okay. So two common tests commonly done. One is the immunoassay. The second one is the whole blood clotting test. So which enzyme? It is acetylcholine esterase basically. Okay. So let me write, bro. Don't worry. No, it basically inhibits release of acetylcholine. Okay, release of acetylcholine. So there is a breakdown of more and more acetylcholine. So that is the mechanism. It produces alpha bungarotoxin, and beta bungarotoxin. So alpha bungarotoxin is postsynaptic, beta bungarotoxin is presynaptic. Yes. Now coming back to this, this slide, look at this. What is this test? Anybody? What is the finding here? A and B. So here 20 ml of blood is taken. So 20 minutes blood is 3 ml of blood for about 20 minutes. So what is the finding in A and B? Anybody can identify? So what is the finding here? So this is your abnormal test. Abnormal test that shows hemotoxicity. So that shows decreased levels of fibrinogen. Okay. So is this clear, guys? Shall I move ahead? So we discussed about big four snakes. I also discussed about signs and symptoms and also about the investigations. Now the last part is the management. So management, so we are talking about. So management of snake bite. There is something known as right approach. Right approach. Right approach in snake bite. So what do you mean by R? What do you mean by I? Anybody can identify what is right approach? Anyone? What is right approach in case of snake bite? Sumana De. So look at the image. So there is a history of snake bite showing some signs and symptoms of snake bite here. What is right approach in this case? What is right approach in this case? You can see clearly visible fang mark. Local signs and symptoms are there. You can also see cyanosis. There is also there are also some blisters are there. So what is the right approach in snake bite? That can be a 3 marks question. Yes, yes, very good. R for yes, reassurance. Very good. R for reassurance. Very good. Reassurance. So, dear students, remember the most common cause of death in case of snake bite is fear. The fear induced heart attack. That's why the first step is reassurance. You need to reassure the patient. Okay. So, reassurance, that is the first step. I for immobilization. Immobilization by using some wraps, Sutherland wrap. Okay, just to prevent the spread of venom into the deeper tissues. I for immobilization, you need to immobilize the patient just to prevent the entry of venom from superficial vessel to deep vessel, from the deep vessel to the major organs like heart, kidney and all. Immobilization. So GH, get to the hospital. Very good. So get to the nearby hospital. Why? Because the treatment of choice in case of snake bite is polyvalent antivenom that is available only in the hospitals, right? So T for tell the doctor. So tell the doctor about the emergence of the symptoms. So just to find out whether it is neurotoxic snake bite or it is hemotoxic snake bite. So this can be a 3 marks question. What do you mean by right approach? So R for reassurance, I for immobilization. So get to the nearby hospital and tell the doctor about the emergence of symptoms. So this is the right approach. Remember, no incision, no drainage, no tourniquet. Tourniquet can lead to gangrene. That's why no ice packing, no incision, drainage and all. Okay, this is the standard method that is known as right approach. Right approach. Very good. Now next heading is the treatment. So treatment. So here is the approach. So all of you, what is this approach? Can identify what are this maneuver which is shown in the picture? What is this and what is this? You can see incorrect method. This is tourniquet. So you can see the multiple tourniquet are applied over the limb that can lead to gangrene of the limb. That's why it should be avoided. It is not done in case of snake bite. So this is the simple wrapping, wrap around the snake bite just to prevent the entry of venom into the deeper structure. Okay, so this is right and one more is wrong method. Okay, Sutherland wrap, very good. Sumana they said it's Sutherland wrap, that's fine. So the treatment of choice is snake anti-venom. Snake anti-venom, that is the polyvalent enzyme refined equine immunoglobulin. So this is the treatment of choice. Treatment of choice, it is going to protect big four snakes. Big four snakes. Again, it depends on the depends on the signs and symptom. In mild cases, we give around 5 to 10 vials. In moderate cases, around 10 to 12 vials. In severe cases, around 15 to 20 vials are given. It all depends on the signs and symptoms. So this is polyvalent anti-snake venom. Anybody, what is the most common side effect of this? What is the most common side effect of this snake anti-venom? Anybody? Anyone can answer this? Snake anti-venom, what is the most common side effect? So once you start this anti-venom, one common manifestation, common side effect is anaphylaxis. Anaphylaxis. So the treatment is epinephrine. 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 So the most common side effect, because it is horse origin, so it can lead to anaphylaxis. So that's why at the time of giving this anti-venom, you should keep epinephrine and other other anti-allergic drug nearby. So that is the treatment of choice in case of anaphylaxis. Yes, very good, Mohammad Ashik and Sumana De. Anaphylaxis is the most common side effect. So one more question, guys. What are the indications of giving this snake antivenom? What are the indications? What are the common indications in clinical practice? Okay, to give this antivenom. Anyone? What are indications, guys? Indications. Yes, indications 1, 2, 3, 4. Can you mention some 4 indications of giving antivenom? Yes. Progressive swelling, very good. Progressive swelling or bleeding, excellent answer. So when there is a bleeding, when there is a systemic spontaneous bleeding, okay, or when there is a swelling of the limb involving half of the limb within 48 hours. So bleeding, swelling involving half of the limb within 48 hours, that shows that there is a involvement of the the antigen antibody reaction, so that is probably hemotoxicity. Or when there are signs of neurotoxicity, neurotoxicity like example, ptosis. So we discussed dysarthria, dyspnea, difficulty in breathing, abnormal sleepy, convulsions, seizures, paralysis and all. And one more common indication is hematuria. So when you see hematuria, renal failure signs and symptoms, then you can start the polyvalent antivenom. Again, some books it is divided mild, moderate and severe depending upon the signs and symptom, that we can go through your textbook. So this is how you can mention. Remember, the antivenom dosage is same in children's also. Children's also it is same. Okay. So very good, Deepika Das. Progressive swelling. Mohammad Ashik answered regional lymphadenopathy. Yes, regional lymphadenopathy, that is very common in case of sea snakes. Okay, lymphadenopathy common in snakes. Good, good, fine. And the last part of the discussion is medicolegal importance of snake bite. What is the medicolegal importance of snake bite? Yes, can you answer this? What is the most common manner of death in snake bite? So in forensic medicine, when you are writing your theory exam, you need to mention medico-legal importance in all the questions. You will get good mark in your prof exam. Mention medico-legal importance. Like example, rigor mortis, what is the medico-legal importance? It is a sign of death, it helps in time since death, it helps in also the position of body in which kept, like that. What is the medico-legal importance of snake bite? Yes, the most common one, yes, the most common manner is accidental. Okay, it can be homicidal also. Like throwing snake into the bed of the sleeping person, like common cobra or common crate into the room of the victim. Homicidal. It can be suicidal also. Okay, very rare, not very common. Suicidal. So one example is Cleopatra. The Queen Cleopatra died due to suicidal snake bite. So that also you can mention in your answer sheet. And sometimes it is also used as a cattle poison. So okay, you can mention like this in your exam. Guys, medico-legal importance can be 4 types, sir. One is accidental, is the most common one. Second ones are homicidal, it is used in murder. Suicidal, example Cleopatra. Last one, cattle poison, when snake venom is injected to the animal. So along with the other cardiac agents, like example Abrus picatoris and others. So cattle poison as well. So this completes your main question, that is your snake bite. Okay, have you understood, guys? Have understood this question, guys? Have understood this question? So yes or no? So we discussed about big four snakes and the scientific name, fatal dosage, fatal period. We discussed about the mechanism of toxicity. We also discussed about signs and symptom, and lastly the right approach, that is, and also the polyvalent antivenom, and also what are the indications, and also medico-legal importance. Say yes or no in the chat box. Say yes if you understood, no if you haven't understood. Yes, Deepika Das, others. Yes, come on guys, come on. Yes, Mohammad Ashik. Okay, okay, fine, fine. Okay. So next question, one more very important topic, that is your organophosphorus compounds. I think this question asked more than 10 times in recent 5 years. Organophosphorus compounds. What are organophosphorus compounds? Classify. Explain signs and symptoms of organophosphorus poisoning and also the treatment. Can be a 5 marks question, can be a 10 marks question, can be a 3 marks question. Very commonly asked viva question, organophosphorus compound. Okay, yes. So we are starting next topic, that is your organophosphorus compounds. Okay. So organophosphorus compounds, so they are classified into alkyl phosphates and aryl phosphates. So try to understand guys, organophosphorus compounds, they are used as an insecticide, they are also used as a herbicides, so they are also used as a nerve gases. So nerve gases also act in the same mechanism. So they are classified into alkyl phosphate when alkyl group is there, and aryl phosphate when the aryl group is there. So what are alkyl phosphates of organophosphorus compound? Mnemonic is moth. Moth is a mnemonic. So what is M? Anybody can identify what is that M in alkyl phosphate? Very common insecticide, very commonly used by farmers. Yes, what is M? Anybody? Come on guys, M for malathion. Excellent answer, Muhammad Ashik. So the answer is malathion. Okay, malathion is a alkyl phosphate. It is the also known as kill bug. Kill bug is a common brand name. So the fatal dosage is 1 gram. 1 gram is sufficient to kill the person. So within 24 hours. Okay. Second, OMPA. OMPA, that is around 175 milligram. Look at this guys, the fatal dosage of OMPA is 175 milligram. They are very toxic, very minute dose, even 1 or 2 drops can lead to death. OMPA. Then TPP, HETP, TEP 100 milligram, HETP 350 milligram. 350 milligram, you can see here, even small dosage can lead to death. So the mnemonic is moth. M for malathion, O for OMPA, T for TPP, H for HETP. All these are alkyl phosphates. They are organophosphorus compounds. So all of you write in the chat box, moth in the chat box. Just write in the chat box, interact with me guys. You can interact with me, you can keep me awake, you can keep yourself awake. Moth. Write, keep writing, keep writing. Good. Yes. Next comes is your aryl phosphate. Okay. Aryl phosphate. Aryl means aryl group is there. Mnemonic is MPDP. MPDP. Member of Parliament DP. DP. ठीक है. M for methyl parathion. P for parathion. D for diazinon and paraxone. So very simple it is. So methyl parathione, parathione and diazinon and also peroxone. So all these are the aryl phosphates. So sometimes the question can be asked, so what are name some organophosphorus compounds? You need to mention are alkyl phosphate and aryl phosphates. Aryl phosphates examples are all this. Fatal dosage you can remember 1 gram. 1 gram, 100 milligram, 350 milligram, 175 milligram, even small dosage can lead to death. Okay, aryl phosphates. Good. So next heading is the mechanism. So mechanism of toxicity. So can anybody, what is the mechanism of toxicity of organophosphate compounds? Anyone? Can anyone answer? What is the mechanism? Come on guys, come on, anybody? What is the mechanism of these compounds? Phosphorylation of, okay, very good. So it inhibits, irreversibly inhibits. This word is important. Irreversible inhibition of acetylcholine esterase. Acetylcholine esterase. So try to understand, each word is important here. Irreversible. Remember, organophosphates are irreversible in nature. The action is irreversible. But in carbamates, you know, the action is reversible. So this can be asked in your exam. So irreversible in organophosphorus compound, or there can be aging of the enzyme after 48 hours. But in carbamates, it is reversible. Okay. Inhibition of acetylcholine esterase enzyme. What is the function of acetylcholine esterase? Acetylcholine esterase going to break down the acetylcholine into acetate and choline. So what happens to this mechanism? There will be more and more acetylcholine. So there will be more and more acetylcholine. So there will be increased signs and symptoms of parasympathetic system. Parasympathetic system. So this is the funda of organophosphorus compounds. Yes, very good. Sumana De and Mehdi and Muhammad Ashik, very good, all answered, that's great. Okay. You know, acetylcholine acts on muscarinic receptor and nicotinic receptor. So there are some signs and symptoms of muscarinic system as well as nicotinic system. Okay, so it acts on M1, M2, M3, M4, M5 receptor, NM receptor, NN receptor. It acts on all the receptor. So that is the mechanism of these agents. Okay, signs and symptoms. Signs and symptoms of OP poison. So the most of the signs and symptoms, they starts within 30 minutes. Within 30 minutes, usually gets completed by 2 hours. The mnemonic is sludge MTF. Sludge MTF. So mnemonic is sludge, very old mnemonic. Sludge MTF. S for, anybody can you guess what is S for? Need to guess guys, what are signs and symptoms of OP poison? Yes, come on guys, 1 or 2 signs and symptom, anybody in the live class? Yes for secretion, very good. Yes for, you know, all the secretions get increased. So secretion of parotid gland, submandibular gland, lacrimal gland, so all increased. Yes for secretion, yes for salivation, very good. L for lacrimation because of secretion from lacrimal gland. U for urination, D for diarrhea, G for gastric upset, E for emesis. So you can remember the mnemonic sludge MTF. Okay. Yes. S for salivation. Not only salivation, but also seizure and also sweating. Sweating, remember, sweating is a feature of sympathetic system. Okay. Sweat glands are supplied by sympathetic, but the neurotransmitter is your acetylcholine. So try to understand, this is a very important funda. Sweating is a feature of sympathetic system. So that feature which is common in case of OP poison, probably because neurotransmitter in case of sweat gland is your acetylcholine. So there will be sweating, there will be seizures, there will be salivation. salivation because of the receptor, M3 receptor activation. So S for these three. Okay. L for lacrimation. So L for lacrimation. In some books it is given there will be red color tears. Red tears. So because of excretion of porphyrins in the tears, this is known as chromodacruria. Chromodacruria. This can be asked in your exam, guys. So this can be asked in your exam. Chromodacruria, red color tears are seen in your answer should be organophosphorus compound because of excretion of porphyrins in the tears. Yes, good. So L for lacrimation done, fine. What is U for? Urination. Urination because of action over M3 receptor. D for diarrhea, again M3 receptor. G for gastric upset. So for mnemonic sake, gastric upset. So nausea, vomiting, very common. E for emesis. M for anybody, what is M? MTF is there, no mnemonic. M for anybody. What is M in the mnemonic? So we discussed sludge very easily now. My question is M. What is that M in case of OP poison? Is there any mydriasis or meiosis? Mydriasis or meiosis, constriction of pupil, or it is dilation of the pupil. In Datura poison we see dilation of the pupil. Cocaine poison we see dilation of the pupil. What about pupil in case of OP poison? Can anybody answer this? Yes, M for meiosis. Excellent. M for meiosis, M for muscle cramps. Okay. And T for tremors, tachycardia. F for fasciculation. So F, fasciculation. All these are the signs and symptoms of OP poisoning. Remember, in some books it is given muscarinic symptom and nicotinic symptom. If you write like this also, that is more than sufficient to pass your upcoming exam. Now investigations. So what investigations we are going to do? Anybody? What are the investigation in case of OP poison? Investigations. What investigation we are going to do? Yes, come on guys. What investigations we are going to do? What is the commonest investigation we are going to do? Anybody? Anybody? Okay, commonest guys, commonest. I said commonest. Commonest investigation in case of OP poison. So commonest is your plasma cholinesterase. Okay, plasma cholinesterase level. Plasma cholinesterase. It's very commonly done because it is very easy to do. So pseudocholinesterase present in the plasma, that is plasma cholinesterase level. So depending upon the levels of plasma cholinesterase, OP poison classified into mild, moderate, very severe, like that it is. Okay. So plasma cholinesterase, or best investigation you can do true cholinesterase. True cholinesterase. True cholinesterase also you can do. And other investigations also you can do, routine examination. Pseudocholinesterase, very good. So the next heading is the treatment. Treatment part. So we are into the last part, treatment part. So what is the treatment? Treatment is airway. The first thing, that is the airway you need to maintain. Airway is important, right? Airway, breathing, circulation. Next comes is our drug, that is known as antidote. So that is the chemical antidote. What is the drug of choice? So drug of choice is atropine. Atropine is given. Atropine is given, which is the antagonist. Which is the antagonist of your acetylcholine at the physiological site. Atropine is given. So the dosage is 2 to 4 milligram given intravenously till therapeutic endpoint. Till therapeutic endpoint, that is secretions of, all the secretions become dry. That is therapeutic endpoint. The dosage is 2 to 4 milligram. Okay. Any other drug other than this? Debi Prasad, very good. Debi Prasad, he answered, sir. It is a cholinesterase reactivator, that is known as oximes. Very good. Oximes. What are the oximes? Prolidoxime and diacetyl monoxime. So there are two oximes are given. One is the prolidoxime. The second one is the diacetyl monoxime. So DAM is better than PAM because it can penetrate CNS. So the half life is, so you should give this within 48 hours, within before aging of the enzyme. Oximes are given. Any other drug other than this? One is atropine, you said also oxime. Any other drug given in case of seizure? The common complication is seizure. What is that drug? Obidoxime. Very good. Devi Prasad, obidoxime. Okay. Prolidoxime, diacetyl monoxime, oximes. Oximes are contraindicated in carbamide poison. Okay. So they are going to reactivate the enzyme acetylcholinesterase. Good. Any other drug? Any other drug, guys, other than this atropine and oxime? You need to tell me. Yes, Sumana, yes. So this is your diazepam. Very good. So this is asked in your exam. So the first it should be atropine. The first drug should be atropine. Then if you want, you can start oxime. Then you can start your diazepam. This should be your order. Atropine, oxime, and diazepam. Diazepam basically for convulsions. Okay. Okay. So this is about the signs and symptoms and the treatment. And also you can write about the initial dosage, maintenance dosage of atropine in case of OP poison, what you mean by therapeutic endpoint. You can write about side effects of atropine as well if you have time. Okay. Now, what is the cause of death, guys? What is the cause of death in case of OP poison? Anyone can answer? What is the cause of death in case of OP poison? Or suicide or homicide or accidental poisoning? So what is the cause of death in case of OPA poisoning? Anyone? Anyone can answer this? Yes. Come on, guys. Okay. Okay, good. Sumana, they very good. She answered, sir, respiratory paralysis. So the respiratory paralysis is the cause of death. Good. So the last part is the medico-legal importance. So that is of organophosphate poisoning. So before that, so what is the cause of death? So cause of death. So cause of death, and also what are the post-mortem findings? PM findings. What are PM findings? So these two can be asked in your exam. So cause of death is respiratory paralysis. Respiratory paralysis. What are the PM finding? PM finding, there can be cyanosis. So there can be petechial hemorrhages. So there can be congestion, cyanosis, petechial hemorrhages. So there can be cerebral edema. Okay. So all these are the PM finding. So cause of death, respiratory paralysis. PM findings are cyanosis, petechial hemorrhages, congestion, and cerebral edema. And also remember, there is a smell. So what is the smell? Anybody? What is the smell while opening the cavities in case of organophosphorus poisoning? Anyone? Yes, very good. So kerosene like smell. Good. Kerosene like smell is seen. So kerosene like smell, that is seen. Okay, medico-legal importance. So medico-legal importance is, yes, suicidal poisoning. Especially in case of farmers, because it is easily available, very cheap. Malathion, parathion, and all, they are commonly used as an insecticide, pesticide, herbicides. So easily available in agriculture people, especially farmers. So depression, one of the commonest cause of suicide. So it can be used in suicide. So in fact, it is the one of the commonest agent in India. So to commit suicide. Second thing, accidental poisoning. So especially in case of children's, or in farmers while opening the container, or while spraying the insecticide in the field, accidental poisoning. Homicide is very rare. Why homicide is very rare? Anybody? Why homicide is very rare? Anyone can answer? Why not? OP poison is a agent of homicide or murder. Why? Why? Anybody? Anybody can answer this question? Anyone? I said cyanide is a agent in case of homicide. Agent of choice. Arsenic is agent of choice in homicide. My question, why not OP poison as a homicidal agent? Why not? Anybody? Sumana De? Because of the taste. Very good. It has very bad taste. Very bad taste. Because of the smell, it has a peculiar smell. So people will come to know. That's why it is very rare. Aconite is there, no, that has a very sweet taste. Aconite is known as sweet poison. Okay, you can question also can be asked about aconite. So aconite is a sweet poison. Sweet poison. So this aconite you can mix with any food. You can mix with the curd. You can mix with the pan. Aconite is a sweet poison. It is one of the ideal homicidal agent. OP poison is not an ideal homicidal agent because of the bad taste, because of the smell. Okay, good. So one more thing is about the this OP poison is there, no, that resist putrefaction. Okay, that resist putrefaction. So that's why putrefaction can be delayed in case of OP poison. You can detect OP poison in viscera even after a few days. Okay, so that's all about the OP poison medico-legal importance. So one is a suicidal poison, accidental poisoning while spraying, or in children's. Homicidal poisoning can occur but very rare. But one more point is it resists the putrefaction. It can be found in the dead body even after many days. And aconite is a sweet poison, is a cardiac poison, acts on the cardiac system, causes bradyarrhythmia and death. It is also known as queen of all poisons. Queen of all poison, Mita Jahar. Very good. Mita Jahar is nothing but your aconite. Mehdi Hussain Sheikh. Sumana De, your knowledge in forensic medicine is excellent. Excellent. Very good. Okay, Devi Prasad also. Okay. Now anybody, let me ask you one more interesting question. Which is known as king of all poison? King of all poisons in forensic medicine or forensic toxicology? Anybody? Anyone? Come on guys, come on. Try. Last few minutes. King of all poison or king of all king poison? So there are many interesting questions can be asked in toxicology. What do you mean by king of all poison? King of all king poison. So or queen poison. So all this can be asked. Yes, very good. Deepika Das. So arsenic is known as king of all poison. Arsenic. So king of all poison. Very good. Okay. So arsenic can be a 5 marks question. Okay. So what are the sources of arsenic poison? What are signs and symptoms? Raindrop pigmentation, Mees line and all, neuropathy and all you need to write. Treatment of arsenic poison, chelating agent can be a 5 marks question. Lead poison can be a 5 marks question. Copper poisoning, thallium poison can be a 5 marks question. Gastric lovers can be a 5 marks question. Okay, so many questions can be framed from toxicology. Toxicology very interesting actually. So yes, any doubt in toxicology you can ask me. King of all king poison is thallium. Very good. Thallium. Very good. Deepika Das. Good point. So come back to the question now. So what we discussed about this question is classify OP compounds, right? So alkyl phosphate and aryl phosphate, mnemonic is MOTH and MPDP. So signs and symptoms based on the inhibition of acetylcholinesterase, that is pseudocholinesterase and true cholinesterase. Mnemonic is sludge MTF. All S and all, you know, MTF, meiosis, T for fasciculation, F for fasciculation, tachycardia and all. Then the treatment is ABCD, and atropine is the drug of choice. You can give oximes also, you can also give diazepam, and also you need to write about the post-mortem findings in case of OP poison, and also the medico-legal importance. So if you write, you will get 5 out of 5. So all of you have understood OP poison. Any doubt in this? Deepika Das, Mehdi, Sumana, they. Okay, anyone? Anyone, guys? Anyone? So one more question, 3 marks question asked in your exam, dear students, is about cyanide poison. Treatment of cyanide poison. Yes. Can anyone answer this question? 3 marks question. Very commonly asked. Treatment of cyanide poisoning. 3 markers. 3 markers can be asked. Yes, yes, come on. Come on, guys. What is the treatment of cyanide poisoning? Now let's discuss some 3 markers, guys. Here, there, randomly we are going to discuss treatment of cyanide poisoning. You know, cyanide, cyanide Malika, cyanide Mohan Kumar, so many stories are there about cyanide. Cyanide is an agent of suicide, cyanide is an agent of homicide, it can lead to accidental death as well. Treatment of cyanide very commonly asked. Yes, anybody? Treatment of cyanide poisoning, one very commonly asked. What are 3 agents used? Sumana Day. Extra point, 3 marks question. 3 markers, cyanide poisoning. Let's see who is going to answer this. Come on, guys. Cyanide, you know, cyanide causes histotoxic anoxia. It acts on electron transport chain, inhibit complex 4. So it causes death. It causes immediate death. Treatment of cyanide poisoning. Anyone? Anyone? So it is sodium nitrate. Sodium nitrate. Okay. Sodium thiosulfate. Sodium thiosulfate. And one more is amyl nitrate. Amyl nitrate. So 3 agents are used. Very good. So sodium nitrate, which causes methemoglobinemia. This cyanide is going to bind with the methemoglobin. It forms cyanomethemoglobin. This cyanomethemoglobin combines with sodium thiosulfate. It forms stable compound and gets excreted in the urine. So this is the funda, try to remember. Sodium nitrate causes what? Fe3 plus. Fe3 plus. What do you mean by Fe3 plus? Methemoglobinemia. Methemoglobin, you know, that binds with cyanide. Cyanomethemoglobin. Cyanomethemoglobin combines with sodium thiosulfate. It forms stable compound which excreted in urine. Okay. So this can be a 3 marker. 3 marks question. 3 marks question. Okay. Yes. Yes, guys. Now one more 3 marker very commonly asked in your exam is carbolic acid. Carbolic acid. So what are the signs and symptoms of carbolic acid? So anyone, what are the signs and symptoms of carbolic acid? 3 markers. 3 mark question. So carbolic acid, you know, it is a systemic acid. So it acts on the major organs. Okay, it acts on the brain, it acts on the kidney and other organs. It produces signs and symptoms. So what are the signs and symptoms of carbolic acid? So anybody? What are signs and symptoms of carbolic acid? Come on, guys. 5 symptoms, 3 marks question, 3 markers. Yes, Adarsh Maurya. Adarsh Maurya and others. Chalo, batao. Very good. Mehdi, excellent answer. It acts on CNS. It causes coma. Very good. Coma. You can remember with the help of mnemonic, 5 C's are there. 5 C's of carbolic acid. So one C you said, that is the coma. Second one, it causes uchronosis. Uchronosis. Okay. Pigmentation of cartilage. that is seen in alkaptonuria, uchronosis. C Farre. Any other C? C depression. C you said okay. Coma. So it causes. Yes, come on. Anybody? Anybody? Constriction of pupil. Constriction of pupil. Constriction of pupil. Yes, very good. Carboluria. Carboluria. Very good. Carboluria. Yes. Good answer. Yes, it also causes corneal deposition. Corneal cartilage deposition. So this is how you can remember many answered. So what are the 5 C's of carbolic acid? Coma. So it acts on brain, causes coma. Uchronosis. Uchronosis means pigmentation of nose, ears and all, seen in alkaptonuria. Constriction of the pupil. Carboluria, that is green colored urine because of the pyrocatechol derivative in the urine. Then corneal deposition. There are 5 C's of carbolic acid. Fatal dosage is 10 to 20 ml. Fatal period is 3 to 4 hours. So this can be a 3 markers. 3 markers in your exam. Okay. Shall I discuss some more 3 markers, guys? Some more 3 markers in your exam. Are you ready? Shall I continue? Some more 3 markers. Adarsh Maurya. Good evening, Adarsh Maurya. If you have any doubt, you can ask me anything from forensic medicine or anything from toxicology. You can ask. Come on, guys. Mehdi. Okay. Good, good. So we are discussing some more 3 markers in forensic medicine. So you can ask me any question from forensic medicine. Okay. Just give me 3 markers. Let me discuss about that. Okay. Fine. So one more 3 marker very commonly asked is your gastric levers. Okay. Gastric levers. Gastric levers. What are the contraindications? What are the contraindications? Very commonly asked 3 markers question. 3 marks question. 3 markers. What are the contraindications? Yes, think and answer, guys. Think and answer. What are contraindications? 6 contraindications. So we're discussing 6 contraindications of gastric levers. So any one. Can you mention 1 or 2 contraindication, guys? Yes, so when question asked no gastric levers, the most common absolute contraindication. Absolute matlab gastric levers is contraindicated. Absolutely contraindicated. Don't do that. So your answer should be corrosive poison. Corrosive. Corrosive. Except carbolic acid. Except carbolic acid. Remember, this is asked in your exam. Corrosive except carbolic acid. Remember, carbolic acid causes hardening of the stomach. That's why in carbolic acid you can do gastric levers. So gastric levers commonly done in left lateral position. So Edwards tube, other Bose tube and all used in gastric levers. You can pass the Drell's tube also. You can pass in the gastric levers. So corrosive is absolute contraindication. So some student answered, sir, coma patient. Very good. Coma patient, okay. Or in case of convulsions. So convulsions, like example tetanus. So or in case of strychnine poison, basically strychnine poison leads to convulsions, relative contraindication. Or when there is a history of varices, esophageal varices are there. Kerosene poison. Kerosene poison, okay. Some student answered, sir, hypothermia. Hypothermia, it aggravates hypothermia, that's why. So if you answer like this, you will get 3 out of 3. So any 6 contraindication, you will get 3 out of 3. So I'll repeat again: corrosive, coma, convulsions, varices, kerosene, hypothermia and all. Remember, carbolic acid is not a contraindication. Okay. Okay. Now one more 3 markers we are going to discuss is your cardiac poisons. Okay. Next heading is your cardiac poison 3 marks question. Name 6 cardiac poisons. Anyone, can you mention some cardiac poison? 3 markers. 3 markers. 1, 2, 3, 4, 5, 6. 3 markers. Anyone, guys? Anyone? Cardiac poisons. Now, next question about the cardiac poison. 3 markers. Okay. So, cardiac poison, it acts on the heart. So, it causes bradyarrhythmia, which causes cardiac block and the death. So, one very common is your nicotine. Okay, nicotine tabacum is there, no? That is the commonest one. Nicotine tabacum. Okay. So, next I think who answered? Deepika Das answered. Sir, nerium odorum. Very good. Nerium odorum. Nerium odorum. What is the toxic principle? Nerin. Nereoderin. Okay. Nerium odorum. Okay. So, that is known as pink oleander. Pink oleander is nerium odorum. Then, when who answered? Oleander, nicotine. Okay, fine. So, Cerebra tivicia. Cerebra tivicia. Okay. Remember, nerium odorum is pink oleander. And this tivicia is yellow oleander. So, you can remember nerium odorum, Cerebra tivicia. So, I used to make song in the classes. So, nerium odorum, Cerebra tivicia. Like that you can make. So, you will not forget only. Okay, Cerebra tivicia, you answered very good. Aconite, very good. Aconite is a cardiac poison. Very good. What is the active principle? Aconitin. I know root is the most toxic one, which causes alternate dilation, constriction of the pupil, which is known as hippus. Very good. Sweet poison, excellent answer. Good. Any other point? Aconite you said, oleander you said, digoxin, yes. Digitalis. Digitalis. One more is Cerebra odolum. Cerebra odolum, known as green mango. Green mango. Okay, green poisonous mango. Okay, good, good. All answer. Deepika Das, excellent. Sumana De, excellent. Mehdi Hussain Sheikh, excellent answer. Very good. Many answered. So, 6 cardiac poisons are nicotine, nerium odorum, Cerebra tivicia, aconite, digitalis, and Cerebra odolum. Very good. Now, the question can be asked about spinal poison. So, next is the about the strychnine poison. Strychnine poison. What are signs and symptoms? Signs and symptoms. Yes, come on, guys. What are signs and symptoms? So, yes, 5 or 6 you need to mention in the exam. Come on, guys. Who is going to answer this? Strychnine poison. So, strychnine poison means Nux vomica poisoning. Nux vomica is the name of the plant. The active principle is strychnine, which acts on the spinal cord, inhibits glycine. So, which causes tetanus-like signs and symptoms. 3 markers. So, 3 marks question. 3 marks question. Okay, what are that? What are they? Okay, Praveen Kumar. Yes, I can make more enjoyable. Yeah, fine, fine, fine. Okay, no problem. Praveen Kumar, I can make you happy. Don't worry. So, strychnine poison means spinal poison. Yes, for yes. So, what are the features of spinal poison? One is very important is your. So, there will be okay. Rhizus sardonicus. Rhizus sardonicus. So, rhizus sardonicus means involvement of a facial muscle. Okay, it is also known as devil's smile, devil's cry. It is known as rhizus sardonicus, involvement of the facial muscles. Okay, good. Many answered. And there will be opisthotonus. Good. Opisthotonus. Opisthotonus. So, there will be backward bending of the body, that is known as opisthotonus. So, that is also seen in tetanus poison. Any other point? There will be forward bending, that is known as amprosthotonus. Amprosthotonus. There can be sideward bending, that is known as pleurosthotonus. Pleurosthotonus. There can be respiratory paralysis. Respiratory paralysis. Okay. Okay, there can be salivation. So there can be salivation, there can be vomiting. So vomiting. So all is signs and symptom resemble like tetanus. Okay. The treatment is short acting barbiturate. The treatment is short acting barbiturate. Okay. Yes, yes, guys. Okay, 3 marks question. What are signs and symptoms of strychnine poison? Rhizus sardonicus, opisthotonus, emprosthotonus, pleurostotonus, respiratory paralysis, salivation, vomiting, and others. The plant name is Nux vomica, bitter in taste. The fatal dosage. Can anybody answer what is the fatal dosage of strychnine poisoning? Come on, Praveen Kumar Shah. Praveen Kumar Shah, what is the fatal dosage of Nux vomica? Nux vomica. I am giving you clue. 1, 10, 100. 1, 10, 100. Yes, yes. Come on, guys. Yes, yes, yes. 1 crush seed. Excellent answer. So, 1 seed is enough to cause death. 1 seed. Remember 1, 10, 100. 1, 10 and 100. 1 for strychnine, 10 for castor. 10 castor seed can lead to death. 100 for datura. So 1 for Nux vomica, 10 for castor seed, 100 for datura. You can remember mnemonic, sir. 1, 10, 100. 1, 10, 100 is a mnemonic. Okay, guys. Mehdi Hussain Sheikh, Sumana De, Sharos. Okay, fine. Chalo. Next important is your datura poison. So one more very commonly asked question, datura poisoning. So treatment of datura poisoning. Treatment of datura poisoning. Yes, anybody? 3 markers. So specific question, what is the treatment of datura poisoning? Treatment of datura poisoning. Yes, come on guys, come on. So you know datura is a deliriant which causes a state of confusion and all, right? So drug of choice, very good. So the first thing is gastric lovers. You know, by passing Ryle's tube or Eval's tube or Bose tube, you can do gastric lovers. Later you can do activated charcoal, which is a physical antidote. Then you can give physostigmine. Physostigmine is given, which is an antidote, not the neostigmine. It is a physostigmine which can cross the blood-brain barrier. You can also give pilocarpine. Some books gives pilocarpine is useful. Okay, so this is the treatment of datura poisoning. Fatal dosage is 10 seeds. 10 seeds. The fatal period is 24 hours. 24 hours. Okay. Slow IV, very good. Mehdi Hassan answered, sir, slow IV. So this physostigmine, you know, it has lot of complications. So it can cause a cardiac complication. That's why we should be very cautious while giving physostigmine. So, and datura, what is the medico-legal importance? You know, it is a road poison. It is used in robbery, especially in railways, or in case of bus stand and all, robbery, sexual assault and all. So it's basically road poison. It also used in infanticide, cattle poison as well. Okay. So this is about the datura poisoning treatment. Oh, good. So I said 10, it's 100. Very good. Sorry. So this 100 seeds, I said 100 correct answer. Maybe it is 100 seeds. Good answer. Good. Chalo. Next question. Okay, cardiac poisons we discussed. Organic irritants. Okay. So the question can be about name organic irritants. Name organic irritants. 3 markers. So 3 marks question. Organic irritants. 6 organic irritants you need to mention. Can you mention one organic irritant, guys? Organic irritants. One organic irritant. Okay. So organic irritants basically organic in nature. So they are used as a cattle poison. They are used in homicide and all. So it is very difficult to identify organic compound in the blood. So organic irritants. So irritants means they cause anaphylaxis. So they inhibit protein synthesis. They cause brain hemorrhages, kidney hemorrhages. They cause liver hemorrhages and all. So basically they cause anaphylaxis. What are organic irritants? One is your Ricinus communis. Ricinus communis. Ricinus communis. Okay, Ricinus communis. Also known as castor seed. Castor. Active principle is resin. Resin. Okay, good. So good. Next, okay, croton. Very good. Croton tiglium. So need to write proper answer. Croton tiglium. Okay. So next comes is your calotropis. Calotropis. Good answer. Calotropis gigantein or Calotropis procera. Next comes is your Abrus precatorius. Abrus precatorius. Abrus precatorius. Next comes is your Semicarpus anacardium. Semicarpus anacardium. Semicarpus anacardium. And one more, anybody? One more? Can you mention one more? Yes, Sharos, I can understand. MBBS is very hard. You need to work hard to become a doctor. You need to work hard. So you need to read all the previous year papers, all the questions. You can go through. You can ask your teachers. You'll definitely pass. Don't worry about it. Yes, capsicum annum. Okay, one more is capsicum annum. Capsicum annum. So which causes human hand. Very interesting word, a human hand. So all of you write in the chat box, human hand in the chat box. It is not human hand, guy. Human hand. Human hand is a allergic dermatitis which is caused by capsicum annum, which is very common in chef. I know those are working in restaurant, those are working in working with the capsicum annum, chili seeds. It's very common. Human hand. All of you write a word human hand in the chat box that is caused by your capsicum annum. So all is our organic irritant. Organic irritant. Yes. So Deepika Das. Okay, everyone write human hand in the chat box. Human hand. Human hand. Not human hand, guys. It is the human hand. Okay. Now here I'll discuss one more interesting murder case, umbrella murder case. Okay. So anybody, can you guess what was the agent used in umbrella murder case? Anybody? Umbrella murder case. If you answer, you will get 3D chocolate from me. Umbrella murder case. Very interesting case. Umbrella murder case. What was the agent used in umbrella murder case? Come on, come on. Come on, guys. Yes, very good. Deepika Das, you should get 3D chocolate from me. Very good. Very good. Very good answer from Deepika Das. Good, very good. So it is actually Ricinus communis. Ricinus communis that was used in umbrella murder case. So you can go through umbrella murder case by typing that in your Google. Okay. Yes. This completes your organic irritant. So next, what are the question can be asked? Okay. So we discussed about general. Okay. Antidotes can be asked. So antidotes can be asked. Strychnine poison can be asked. Alcohol. So one very important topic, guys, is alcohol. Okay. Alcohol. Alcohol can be asked. 5 marks question. 5 marks question. Opium can be asked. So opium can be a 5 marks question. Drug dependence. Drug dependence. Drug dependence can be a 5 marks question. 5 marks question, guys. A 3 marks question. What difference between drug dependence and drug habituation can be 5 marks question. Okay. Cannabis can be a question. Cannabis can be a 5 marks question. Antidotes from general toxicology. Antidotes from general toxicology can be 5 marks question. Okay. So all these are commonly asked in your exam. Yes, guys, do you want me to continue some more topics? Shall I move ahead? Yes, guys. Yes, come on, guys. All this you just go through this through our recorded lectures in PW. Alcohol, opium, drug dependence, cannabis, antidotes, dry wine, can be strychnine we discussed today, datura we discussed today, cocaine. So cocaine is one more question can be asked. Cocaine, 5 marks question. Okay. Arsenic can be a 5 marks question. So arsenic. So just go through these topics, guys. Arsenic, lead, copper, thallium, mercury also asked. Okay, mercury also very commonly asked in your exam. Mercury. Yes, fine. So that's it about the today's discussion. So we'll come up with some more lectures, especially forensic medicine practicals in upcoming days, probably on Monday. Just a overview of all the FMT practical question that can be asked in your exam, that we are discussing in Monday. That is the last class of your Farre series. So yes. Okay, tacrylline, Kimunto, why gastric lavas contraindicated in kerosene poison? Excellent question from our student Kimunto. Kimunto, gastric lavas is contraindicated in kerosene poison because kerosene poison, so if it enters lung, it can lead to aspiration pneumonitis. Okay, kerosene definitely not absorbed from your small intestine or large intestine. The most common complication or most fatal complication is your pneumonitis. So once it enters the lungs, it causes chemical pneumonitis. It's very difficult to treat. That's why in kerosene poison, because of risk of aspiration pneumonia, that is relatively contraindicated. It's a relative contraindication. It is not an absolute contraindication. So answer for your question is chemical pneumonitis. Okay. Yes, so B pharmacy, do you have any doubt? Do you have any doubt? You can ask me. So we discussed so many important topics today. I hope you all understood forensic medicine. Okay. So Deepika Das and others have understood today's topic. Am I very slow or very fast or very boring? Can you give me the feedback? Okay, Mehdi Hussein Sheikh, thank you very much for amazing session. Thank you all. Thanks for your patience. You all are very interactive. It's lovely students. Okay, Mehdi Hussein Sheikh, good, fine. So that's it about the today's Farre series. Thank you all. Wish you all the best for your upcoming theory exam. Thank you.